Hi, I'm Dr. Patti Farris, and I'm your host of this episode of Skincare Confidential. We're excited to be coming to you live from the Science of Skin Summit today, and I'm really excited to have my guest, who's a good friend of mine, but also somebody who's really a trailblazer in our specialty, Dr. Saranya Wyles from the Mayo Clinic. She was the chair and the moderator of our session on longevity, which is a whole new emerging field in dermatology. So welcome.
Thank you, Patti. Great to be here.
And let's start talking about your area of interest and how you really got into this longevity space.
Absolutely. So I got into regenerative medicine space when I was thinking through the concept of wound healing and how we heal and trying to better understand how the body naturally heals. And when we think about wound healing, it's all mechanisms of repair and how we combat and build the barrier up again, right? But the antidote or the opposite of wound healing is these defense mechanisms that you consistently accrue with aging. So as we age, our wound healing repair responses decline. And with that, we wanted to understand, well, why does this happen? What are the barriers to healthy regeneration? And the idea was that there are these root cause cellular and molecular changes that can affect the way we regenerate. So that's how I got into longevity, is to better understand these barriers.
Yeah, and so we're now seeing the merging of regenerative science, let's say, and skincare. So talk about that and your role in the development of the platelet-derived exosome product.
Absolutely. So exosomes are a very popular word right now. There's a lot
They're
of
a buzzword for sure. Having a moment.
Exactly. They're having a starlight moment. So it is a buzzword, and it's kind of getting a lot of attention because it's got a lot of promise around it. These can regenerate and they can repair and heal, but they can also be derived from cancer cells. So they can be inflammatory and harmful. So exosomes are a blanket word. We want to think about what is the right source for the exosomes. And one of the most promising regenerative sources is platelet-based exosomes. So we've helped develop the platelet-based exosome products in clinical trials, but also in aesthetic studies to try to see how these can be helpful for patients' skin rejuvenation.
So what's in these exosomes and how do they really work to help enhance wound healing and make your skin look better, more importantly?
Absolutely. So in the context of platelet exosomes, the source, it dictates the story. So It's the idea that platelets are the first responders to wounds. They're naturally regenerative. They have the right communication signals for repair, healing, antioxidation. So there's a lot of positive ways that they can mitigate the wound repair cycle and or benefit the wound repair cycle, and they can mitigate harmful stressors.
So how do they work to prevent skin aging? And also they've been looked at, I know, in post-procedure, which makes total sense, of course.
Exactly. So these platelet exosomes, they can help reestablish the skin homeostasis. So they can help the fibroblasts boost them to produce the extracellular matrix proteins. They can help the keratinocytes turnover, create healthier barrier proteins, and kind of keep that barrier intact. They can help reduce the noise from senescent cells within the skin, aging skin. So you produce better collagen, better elastin, better matrix proteins over time. So they have a lot of benefits that are both pro-repair, but also defending some of the aging insults that we can see.
So I know they're nano-sized particles and they can penetrate the skin, but like what's inside them? What's the magic inside them?
Yeah, this is the exosome story is thousands of signals that are held within the particle themselves. So you can think about it as where like the whole book that's written. I often talk about signals from the humans can be very short or very long. So when you think about amino acids, these are letters like A, B, C, D, E, F, G. Then you have peptides that are short words like cat, apple, bat. Then you can have proteins or growth factors. These are sentences. They can kind of say things like the cat meows or go to the store. I
love this analogy. It makes total sense.
Yeah. But then you get to exosomes and now it's a book chapter. So this is one of the reasons why it's been so complicated to get the whole story out. We can sequence exosomes and we can understand what is actually kept within them, which is microRNAs, cytokines, signaling peptides, and other particles that can help regenerate and restore based on the source. But the story is quite long.
Super interesting. So the name of the product line is Plated,
Yes.
which is great, just so that listeners know where these platelet exosomes are found. Let's kind of transition from regenerative to longevity. So that was such a great session yesterday, but maybe
Thank you.
differentiate those two and like, where are we going with this whole longevity play? It's so fascinating.
Thank you. Yes, it's so regenerative medicine and longevity science, they fit together. And you can kind of think of one as anabolic and the other one as catabolic. So I mean like yin and yang, okay? Regenerative medicine are builders. So they're like anabolic ways that we can help repair, restore, reprogram, renew. So it's all the positive benefits of how you build a house. But longevity science is about prevention. So this is about resisting damage and how you can prevent, slow down, or reverse the insults. So if you're thinking about a car, for instance, right? Regenerative medicine is the tires that you can replace, and the parts like engine, things like that you can replace, versus longevity science are like getting your oil changed, getting your tires rotated, just making sure that you're reducing the predilection to damage.
Right. That makes total sense. So talk a little bit. I mean, we don't just want to be living longer and have our skin. We want to be healthier, right? Yes. So talk about skin span and all these things that you kind of need to understand, I think, to differentiate these two disciplines. But I love that analogy. One sort of the build up, the other is the breakdown.
Absolutely. So skin health can be thought about over time. We want to preserve skin structure, but more importantly, skin function as we age as well. So how do we retain healthy skin aging over time, which we think about as a skin's health span, also known as skin span, which we've trademarked at Mayo Clinic. And this is the idea that we can preserve that skin longevity, both by helping it repair its natural ways that it does, but also increasing its resilience to stress.
So interesting. So do we think that at some point that we really can use topical skincare that will do that for our skin?
We are better understanding the root causes of aging and the root cause of skin aging. So at the cellular molecular level, what are these hallmarks of aging that we've identified that we can tap into and kind of biohack or bioengineer how we can resist damage better, right? And build that resilience over time. So I think we're definitely at a very exciting time in science right now where we can deep dive into these specific hallmarks, influence these pathways, and try to see how we can build better skincare around that.
That's so fascinating. Thank you so much for sharing your knowledge with the Science of Skin Summit, and you've taught me so much. So thank you so much for being here. And for those of you who are listening, if you've enjoyed this episode, we appreciate it if you would subscribe and give us a nice 5-star review. And Dr. Saranya Wyles, we're going to have her back for sure because she is where exactly we want to be at the Science of Skin Summit, on the cutting edge of what's going on in skincare and skin science. Thanks for listening. Have a great day.